This adds to the dynamic of the U.S. being the laughing stock of the world in many respects, or the freak show of the world. I think there are probably people in other countries who look down on us in the sense that they think, oh, you poor fools. You poor fools. So this is in the Seattle Times. Coronavirus survival comes with a $1.1 million 181-page price tag. $1.1 million for coronavirus treatment. Can't make this stuff up. So the gentleman's name is Michael Floor. He's 70 years old. He was in the hospital for 62 days. 62 days. Now, I'll give you the exact number in a second, but let me give you a little breakdown of the costs here. The ICU room that he was in, which is a special, pandemic room that's kind of sealed and everything, $408,912. That's what just the room cost. The mechanical ventilator that he was on for 29 days, he was billed at $2,835 per day. So you do the math on that. $2,835 times 29. So it says it here. Total of $82,215. That's how much for the ventilator. And about a quarter of the bill is just drug costs. There was a time where he was in dire straits, and so the doctors were like, I don't know, throw everything we got at him. Throw whatever, experimental, non-experimental, off-label, on-label, whatever it was, hydroxychloroquine, remdesivir, whatever. Everything that potentially may work, just throw it at him. We're going to do everything we can to try to save this guy. So about 25% of the cost was drug costs. Now, the exact number, this is the exact number that he got a bill for. You ready? $1,122,501.04. See, what's so amazing about this story is I led, and the headline says $1.1 million is what the bill was. The real bill was $1,122,501.04. Our system is so messed up that even the difference that I told you there, the difference of the bills, okay? I said 1.1 million, but the real number is $1,122,501.04. Even just the difference would be way too much as a medical bill. The difference would be $22,501.04. The difference in how I describe the bill and what the actual number is, that alone is too much for a damn medical bill. Now, there's actually a little bit of an open question, which gets to another part of our absurd healthcare system. There's an open question as to who's paying for it and how they're paying for it. So he has insurance. He also has Medicare. So, the article basically said well, he may only have to pay a small percentage of it. Okay, but any small percentage is going to be a huge as a raw number because it's a percentage of $1.122 million. So they're not sure if he's going to pay a percentage of it or if all of it's covered because he has Medicare plus, I think, the insurance on top of the Medicare. So nobody's more covered than this guy, and it's still a question as to whether or not he'll have to pay something. But the bill was the length of a novel, 181 pages. Now, I submit to you, because I can already hear the responses from conservative people or people who would defend the status quo for our healthcare system. They'll say, yeah, but the reason he was just in there for a really long time, so of course the bill is going to add up. Guys, if you look at the exact same treatment that somebody got in a country that has universal health care, I guarantee you the bill would be probably less than half of this. So yeah, it's going to be a lot because they're there for a long time. But it's not going to be $1.122 million. That's not going to be it. Because here in the U.S., our healthcare system is the least efficient, the most expensive, and literally we pay like double what other developed countries pay. So there is no way to explain this story away as if it's reasonable, understandable, acceptable. And it's just, now imagine for a second, this guy who might be lucky enough to get it all covered. Okay? Imagine it was somebody without health insurance, without Medicare, without Medicaid, without health insurance or with bare bones health insurance, like the bare minimum, you go bankrupt. Period. You can't pay it. You can't afford it. You go bankrupt. In this country, medical bankruptcies, that's one of the top causes of bankruptcy. Other developed countries do not have medical bankruptcies. That is not a concept that exists in other developed countries, but we have it. Just so everybody understands, the Federal Reserve was pumping $1 trillion a day into the stock market to prop it up. $1 trillion a day in liquidity. We had the bailout from Congress of corporations, which was over $5 trillion when all said and done. Over $5 trillion. But we still don't have free healthcare for the country. We still don't have free college. By the way, we had at least 20 million more people lose their health insurance since the beginning of this pandemic because people are losing their jobs. And when they lose their jobs, they lose their health insurance because oftentimes your health insurance is tied to your job. Do you understand the laughingstock that we are here? Do you understand how broken our system is? And do you understand that even the Democratic response, they're supposed to be the left-wing party, their response was, let's subsidize COBRA. You know what that is? That's a giant giveaway to health insurance companies. COBRA is a system that lets you buy into the health insurance that you had when you had your job. So you lose your job, but you could still get that health insurance. But the Democrats want to subsidize COBRA, which is just a giant giveaway to the health insurance industry. There is no real left in the United States of America. It is embarrassing. It is embarrassing. Over $1 million bill because you got sick. No fault of your own. Lives are ruined as a result of this stuff. Anybody who's not in favor of Medicare for all could piss right off. I just have no interest in you because you're not even hitting the bare minimum threshold of being a decent, moral, ethical human being. You're not even hitting the bare minimum threshold. You can't even say, hey, let's catch up to the rest of the developed world and have everybody have healthcare as a right. You can't even say that. That means you're biased and you're corrupted by our disgusting, rotten system. And you are part of the swamp. And I can't stand by. I can't abide that. I just can't. So I have no interest in you if you're not for Medicare for all. This isn't a debatable issue. This issue's been settled for a long time, and I don't know how much more evidence you need, but my guess is the more I keep piling on the evidence, the more they'll cover their eyes and ears, because really, they take money from these health insurance companies, so these politicians are going to do the bidding of the health insurance companies, even if it means ignoring stories like this.